Hello, everyone. My name is Daysi Zentner. I am a doctoral intern in psychology at the Emotional Health and CBT Clinic, and I am a PhD candidate in the Counseling Psychology program at McGill University. And this is the second part of the social anxiety presentation. So in the first part, I introduce generally what social anxiety disorder is, and we look at the specific components that are maintaining social anxiety. In the second part, we're going to be covering how do we treat social anxiety disorder. So we're going to be, in terms of CBT, we're going to be focusing on some of the cognitive therapy, some of the exposure therapy, and then at the end, we'll briefly discuss some of the medication treatment for anxiety. So, as an important first step in learning to manage social anxiety, it really involves to better understand your own social anxiety. So, people really with social anxiety disorder tend to fear different types of social situations. So, for example, talking to a coworker or speaking in a meeting or going to a party. You might also experience very different physical symptoms of anxiety, and that might be blushing or sweating or increased heart rate, for example. So the first step for treatment really is to get to know your anxiety. And so it's important to take the time to take note of what is it that you are afraid of. And then a second step to prepare yourself could be learning ways in which you can relax. So feeling anxious can be quite uncomfortable. And so by learning to relax, you can turn down some of the volume of these physical symptoms of anxiety, which can make it a little easier to face social situations. And this can include some calm breathing, muscle relaxation, and mindfulness techniques. And calm breathing really is a strategy that can be used to calm yourself down quite quickly, because we tend to breathe faster when we're anxious, and this can actually make us feel dizzy and lightheaded, which can even makes us more anxious. So calm breathing involves really, taking regular breaths slowly through your nose. And however, it's important to realize that the goal of calm breathing is not to eliminate anxiety completely, because we know that the anxiety is not dangerous and it's normal to feel anxious at times, but it can make it a little bit easier for us to get through the feelings in a specific social situation. Then muscle relaxation is another strategy that can be used in order to relax your body. And this involves like tensing various muscles and then relaxing them. And this strategy can really help lower the overall tension and stress levels, which contribute to anxiety problems. And a third technique can be mindfulness, which is this ability of really being fully present in the social situation, be aware of where we are and what we're doing, really by using all of our senses. And so then we move on to this cognitive component, to address some of the negative talk that we have that is maintaining the social anxiety and, the self-awareness and self-consciousness thoughts. So how can we do that? Is really by engaging in some realistic thinking. And so if you believe that social situations are threatening or dangerous, then you're more likely to feel quite anxious. However, it's important to realize that your thoughts are guesses about what will happen, and they're not actual facts of what might be happening. So before you start changing the way you think, you need to also identify what are the kinds of thoughts that you're having in social situations. So this, for example, can include no one will like me, or I'm going to say something stupid, I will do something foolish and other people will laugh at me, or I will get anxious and other people will notice, etc. And then really ask yourself, what are you afraid of? Like, what is it that you're more afraid of? And then try to challenge some of these thoughts, right? So are you more afraid of something that you might do, for example, like I'll embarrass myself by saying something stupid, or I will have nothing to say? Or are you more afraid of something that other people might think of you? So for example, others won't like me, or other people will notice that I'm anxious, and then they will think I'm weird. So really, to become more aware of the specific fears that you have, try to identify the thoughts that you're having about the social situations and about the fears that you have about them. And the next step is really to learn to evaluate these negative thoughts that you're having. So remember, these are only guesses about what will happen and not actual facts. So you can use these questions to really challenge some of these negative thoughts that you're experiencing. So for example, if I identify that what I'm afraid of is that what I'm afraid of if I go to a party is that I will say something stupid, for example, I can ask myself, am I 100% certain that, I will say something stupid at the party? And no, not really. I'm not 100% certain. Or how many times have I said something stupid at a party? Maybe a few times, but not always. What is the evidence that support my thoughts? Maybe once I made a joke and no one laughed at, what is the evidence that does not support my thoughts? I have also gone to parties in the past and I did not say something stupid. Last time I went to a party, someone said it was funny. No, now is saying something stupid so important that my whole future depends on it? Well, it would be quite embarrassing, but no, my whole future does not depend on it. Now ask yourself, what is the worst that could happen? If I do say something stupid and people laugh, how could I do to cope? Well, I guess I could try and, crack a joke about it, or I could excuse myself and go get some fresh air if that were to happen. Now, is there another way also of looking at this whole situation? Is it true that everyone says stupid things once in a while? And ask yourself, what would you say to a friend if, they were having these thoughts? Would you maybe tell them that it's not the end of the world, that we all say silly things, and most of the time people don't even remember exactly what we said? And then so people with social anxiety also engage in these unrealistic beliefs. So thoughts like, I need to be perfect to be liked, or I should never make mistakes, or it's important for everyone to like me, or it's not okay to be anxious. But remember that really no one is perfect and everyone makes mistakes. It's also unrealistic to think that everyone will like us. You can ask yourself, do you like everyone that you know, right? Also, anxiety is quite a private experience, and other people don't necessarily notice how we feel. And if they do, it doesn't mean that they think any less of you. Like, if you can think about, have you ever seen someone who was anxious, and was it okay? Was it normal? It's okay to be imperfect and to feel anxious. It's part really of being human. And so rather than, fighting these things, is trying to find a way to work with them. And then, we can test out some of these thoughts, and really this lead us to, these behavioral components. So testing out our fears in social situations. So before we engage, we talk about these behavioral components, very important for us to talk about the role that avoidance plays. So, it's normal that we want to avoid social situations that cause anxiety, because avoiding fear social situations is a very effective strategy in reducing the anxiety, right? The problem is that it reduces the anxiety in the short term only. But in the long term, it really prevents you from learning maybe that the fear that you had, the fear expectation that you had was actually very unlikely to happen, or it's not as bad as you think. So it's very important. A step in managing your social anxiety is to fear these situations that you have been avoiding because of social anxiety. And then, repeatedly facing those situations really reduces the distress in the long term, and it helps us build confidence. So like we said, avoidance really maintains the fear. It doesn't allow you to learn whether or not the predictions that you have are incorrect. It doesn't also allow you to learn that the fear response to some of these physical sensations don't actually last for a very long time. That the level of anxiety won't be as high if you are in the social situation for a longer period of time. Also, avoidance maintains this association between the social situation and the fear that you have. And so it's important for us to break this association through desensitization. And also, we're not always aware of how we are avoiding social situations. Sometimes there's more subtle ways of avoiding and engaging in some safety behaviors. So rather than completely avoiding social situations, some people, might engage in these like safer behaviors. So for example, if you're worried that you would say something stupid, you might try to say as little as possible, or you might remove yourself from the situation, like for example, at a party, going to the bathroom more frequently, or finding a task that will keep you busy, using also alcohol or drugs while in social situations, also by distracting yourself, or by avoiding sharing personal information. And so it's important to really be aware of these safety behaviors that we're engaging on, which are not necessarily fully avoiding the social situation, but that we are engaging in these behaviors as a way of, preventing some of the anxiety happening during the social situation. So like I said, avoidance really, decreases the anxiety in the short term, but we know that in the long term, anxiety is maintained. And so how do we make things better? By engaging in some experiments and desensitization, and you can prepare yourself to do this. Remember what is the motivation that you have. Think about the relaxation techniques. Think about the negative thoughts that you're having them, and reframing them, challenge them with more realistic thoughts. You can also, read about social skills, but remember that you need to stay away from seeing these experiments as social performance, right? You really want to be like engaged in the conversation, really be present in the experiment. And you can visualize the situation ahead of time, and you can find your role in the situation. And so really through desensitization is that anxiety will decrease over time. It will decrease this fear through repeated exposure. So anxiety is high the first time that you engage in this experiment, but by engaging in repetition, the anxiety really decreases over time. And for example, the first 5 minutes, you might experience an emotion quite intense, but then it will not remain at that level, right? And so you learn also that the situation may not be as bad as you imagine. The anxiety decreases over time and it doesn't last for long. And you can also build a hierarchy, like a ladder to build the steps for you to try. So for example, if, when, for example, was worried about giving a presentation at work, and she's worried, about asking and answering questions during the meeting. And, the goal would be really for this person to be able to give the presentation and participate in a meeting at work. They might want to build this hierarchy slowly. So first, the step may be giving a prepared presentation in the boardroom after work when no one is present. And that might still be quite distressing, but not as high as, giving the full presentation in front of all of the coworkers. A second step might be giving the presentation in the boardroom with only one close colleague present. Then, making a comment during a meeting, further along, asking a question during the meeting, then answering a question during meetings, and, finally, giving a prepared presentation during the staff meeting and answering questions during the meeting. So, in order to engage in these experiments, really think first of what thoughts are getting in your way. Why are you avoiding the situations? Is it because you have a negative prediction of the situation? So test them and be open-minded about the experiment, well prepared and open to accept the outcome. And when you prepare the experiments, please remember to be objective when you're looking at the response from others, and don't auto-sabotage the experiment. So for example, if your goal would be to ask a coworker to go to lunch together, that would be the experiment. Well, the prediction is that they will say no, right? But you want to avoid being vague, right? Like, oh, we should do something together one day. No, you really want to be specific. So for example, like, what are your plans on Thursday for lunch? Do you want to go and try this new restaurant together? So be specific in the experiment. Like I said, there are also some medications that can be used to treat social anxiety, and you might have to consult with your general practitioner or the psychiatrist, as medication prescription is not really within the role of a psychologist. And, here is just some information about different medication used for social anxiety. So in general, really, what is important is for you to practice the skills and replace the negative thoughts with more realistic thoughts, and embrace yourself with compassion. Be specific when you're engaging in the risk assessment and in the exposure experiment. Remember that the goal is not to make a good impression. The goal is for you to engage in this specific behavior and not letting social anxiety get in the way of it. And, it's very important for you to practice the skills regularly. Make them an habit. And this is true even after you're feeling better and you have reached your goals. And don't feel discouraged if you start using old behaviors. This can happen during different stressful times in life as well. And this is normal. And it just means that you need to start practicing again and using the tools that you already have. So remember that coping with anxiety is a lifelong process. And so practice, 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 get to know what are the red flags for you, make a plan of action, come up with new challenges, new experiments. What can you learn from your lapses? Like what led you to it? Get to know the facts. Be kind, patient, and understanding with yourself. And remember to also reward yourself when you see progress. So these are some of the resources that I used in preparing this presentation. Thank you so much. And I hope to see you all in the Facebook Live on October 28th. Thank you.